Good morning. Steve Stites here, Chief Medical Officer at the University of Kansas Health System. I'm joined in our studio by Dana Hawkinson, the Medical Director of Infection Prevention and Control. I got all the way through this morning without stumbling. That's pretty good. I've been rehearsing last night and this morning. So today's topic is, did the pandemic make healthcare safer, especially from a state of Kansas viewpoint? And this morning we have some great guests with us. We have Heather Harris, who's the Medical Director on our HaysMed Campus, Christian Whittington, a family medicine physician on the Pawnee Valley campus, and Mark Van Norden, a family physician on our Great Bend, Kansas, in our Great Bend campus. They've been with us before, and they're back today. And we're going to talk this morning about infection control, infection prevention. We're going to talk about infectious disease. I guess that means, Dana, we're talking about COVID-19.
Yeah, and thank you. I would like to first give a happy birthday wish to my sister. She is a wonderful mother and nurse up in Madison, Wisconsin, and they're dealing with this as well, so go Badgers.
We'd sing happy birthday, but I think that would ruin the day.
Yeah, that would break the internet.
Yeah.
But I would first like to get to, it's amazing, like we've always talked about, if you have medical conditions, come to your clinics, see your medical team. There are other people who don't have chronic conditions but have significant illness from trauma or one thing or another, or cancer, need transfusions. You know, blood is vitally important in blood products. We hosted, the university with Community Blood Center hosted a blood drive last week, and it went very well. The goal was 225 units. We actually made it to 266
Yay.
units. So we would continue to like to reinforce, please do not stop giving and donating blood and blood products. Our patients, our loved ones continue to need those, so please continue to contact Community Blood Center and give your blood products. The other thing is, so we have continued to be in the equilibrium here at the health center, at the health system, at the hospital. We have 25 patients in-house today with COVID-19, and 10 of those are in the ICU. So we are just really hanging out this equilibrium type.
This is our new normal right now.
This is our new normal.
For shelter at home. Dana, what's going to happen when we stop sheltering?
You know,
It's just started. I'm walking over to Lewis Park this morning, and the cars are going by, and the people are out, and even though it's kind of a little misty, what do you think is going to happen?
I think I have to be a realist, and we have to assume that as more people are out in public, may or may not be doing the public health guidance. We know that susceptible hosts are very susceptible and this virus spreads, so I think we have to assume and plan that there will be more infections as more restrictions are lessening.
Yeah, I think that's really right. And I think what we have to remember is that no matter whether the government's trying to get you or politics is trying to have us stay at home, the reality is it comes down to personal responsibility. And if we can wash our hands, stay 6 feet away, cough into your elbow, don't go out if you're sick, all those things we say all the time. And when you can, wear a mask. When you do all those things, you do improve, you do really improve things. So Dana, we don't have a mask on this morning, should we?
Well, I think, again, we are talking about 6 feet at a minimum. If you cannot stay away, and the mask, particularly the cloth masks, are to protect other people from you should you be shedding the virus asymptomatically. We are far apart at this point in time. Again, time is another part of the exposure. We do tend to be here for about a half an hour, but in general, if you're in somebody's space for 10 minutes or more, then it's considered an exposure too. But at this point in time, we aren't wearing a mask, number one, in order to articulate our message good, and number two, because we are separated by enough space. And, this is a special situation for sure.
And our interpreter is with us this morning, has a harder time reading our lips if people have a harder time if they can't see what we've got on.
But it should be noted, we did come in with masks.
We do.
They will be on as soon as we're done. And, around the hospital and around the offices, we are always
we're wearing masks. Yep. That's the plan. So let's first turn out to, let's say, Heather, how are you this morning? How are things in Hays?
Good morning. I'm great. And I also want to give a shout out. It's my mom's birthday today as well.
Oh, that's pretty special. I don't think I have anybody whose birthday it is. I'm just a little left out.
Still not going to get a happy birthday song.
No, nobody's going to get a happy birthday song from me. I'm banned from public singing by my family, and that includes showers. Christian Whittington, how are things in Pawnee Valley?
Things in Pawnee Valley are doing very well today. Thank you.
Great. Any special challenges or messages you want to tell us right now?
No, I mean, we're quite fortunate right now in the fact that we do not have any cases in Pawnee County. and we are slowly returning to what will be the new business as usual.
Yeah, you bet. And Mark, how about out in Great Bend?
Things are wet, and that's good.
A little
Otherwise,
bit of rain.
things are going well.
Yeah.
Yes, lots of rain.
All right. Well, let's turn, because I know that rural topics can often have a special interest, and let's see if there's questions.
We have one. Just because there are no cases in the county, does that mean that COVID is gone?
Let's talk. Okay, Christian or Mark, thoughts about that?
No, I don't think it means that COVID is gone. It just means that we've been fortunate enough that we have, due to our geographic location, socially isolated. But we still have to take the exact same precautions. We do fever checks, masks, and social distancing just the same as you would anywhere else.
Yeah.
And I would say that it's very possible that we do have the virus, maybe more than we think we do, and that's why it's important to continue with the precautions that have been discussed
You
prior
bet.
to this.
And Heather, how about in Hays? What's the story there?
Right. So we've been really steady from the beginning. We're seeing our service area expand in number of cases. So we know in the last 6 days, it's increased our service area of 23 counties by almost 15 to 20 cases, which I know is not a lot, but it does mean that, you know, there's still life to this virus. And as we've seen in a week of phase one, there for weeks, there was no rise in cases at all for many weeks. And then just within 1 week of people starting to move around, which is necessary, we're starting to see the rise in the viruses just slowly. So, we're going to see it some more. So, but we've been planning for months for patients to return to the clinic and to the operating room, and we've been very successful in that in the last 10 days, and we'll continue to ramp that up by screening patients, with symptoms first, taking everyone's temperatures. All staff is wearing masks around patients to keep them safe as well. There's an entire process occurring to make sure people are safe to come to elective surgery, including COVID testing before any procedures, operations, deliveries of babies, sleep tests. We're really going to our best effort to keep everyone safe in the hospital and outside of the hospital here.
Yeah, I think, that's really the story, isn't it? And Dana, if you remember when I think these good folks were on a few weeks ago, probably 2 or 3 weeks ago, that map looks so different, the heat map, and now you see it spreading throughout Kansas, and there are some pretty big hotspots out there, especially around meatpacking plants.
Yeah. And we don't just want to pick on them. We know that other places of employment, such as nursing facilities, other office buildings, we've heard that Kansas is investigating 50 or more clusters, and that's just not food processing plants, but just other places of employment. And so it does reach out there. It does get to those rural areas as well.
We do have a follow-up question. We have 3 actually from the community that have just come in. I'm not sure that I have this right, but it says, are nursing homes sponging rural communities? What would they be asking?
I'm not sure exactly what that means. My guess is, I'm going to reinterpret it. I'm going to ask a question the way I want to ask it.
Okay,
So
yeah.
I'm just saying,
Nursing homes in rural communities.
yeah, the nursing homes in rural communities. And my bet is that the thrust of this is, are nursing homes somehow changing or bringing the virus into rural communities, and is that where a lot of it's coming from? So let's turn out there to greater Kansas. Heather, what are your thoughts about nursing homes and rural communities? What's going on out there?
Well, I think locally, ours really began very conservative visitor restrictions from the very beginning, clear back in early March. So we have been, again, I think as I spoke last time, we were on the back end of this curve, so we got to learn from everyone else, and we were smart enough to at least begin learning. And so they've had visitor restrictions from the beginning. They continue that. I was at a nursing home yesterday seeing a patient. We're all wearing masks, all the staff at all times. The residents are still eating in their rooms. family, visiting with them via iPads. So, and then all nursing home patients now are being tested. If they have to come to the hospital because they become ill or need some sort of medical attention, they're all being tested for COVID prior to returning. And then I know one of the nursing homes here locally, when they do return from the hospital, they're actually got them in a different unit for a few days to make sure they don't exhibit any symptoms. And then they get to return to their regular room. So there are lots and lots of steps happening here to ensure that the residents are safe. And we've been very fortunate in both of our 3 counties. I don't think we have any nursing home residents with any COVID concerns in any of our counties. Let me know if I'm wrong.
Mark or
gentlemen.
Christian, thoughts about that?
I would concur what Heather said. Our nursing home has been doing a very good job. New admissions spend 14 days in quarantine, and we're still seeing most of our patients through telehealth so that we don't step foot into the facilities unless needed. But our facility has done a really good job, and as of yet, we don't have any COVID in our nursing home.
So, one follow-up to that would be, are any of y'all involved with any of the meatpacking plants or any of the other clusters that are there? Any thoughts about that?
I think our relation, go ahead. Great Ben probably has a little more involvement than the rest of us. Go ahead.
I do not personally have any involvement with any clusters.
Okay.
I think our involvement here in Hays has been that we're starting to care for patients that are, because of their medical community, a strain in those environments. We're beginning to see other acute conditions being treated here in Hays from those counties, particularly Ford and Finney, as they, continue to kind of treat their COVID patients. Because for Ford and Finney, we are a referral center for them for certain things as well, general orthopedics and a few other items.
Okay, good.
So here's a question. If there's no COVID in my county, because there's no cases, and I'm being told that I need to take a COVID test in order to have surgery, I don't want to take a test. Why do I have to take a test?
There's pretty good logic around the taking of the test, and the reality is we take tests to protect ourselves, Dana, or for our patients to be protected, not us, the physicians, but rather the patient to be protected.
Safety.
Because we know that after surgery, if you've had COVID, you don't do as well.
No, absolutely. It's for patient safety, and we understand there's no COVID in the county. That may be for a variety of reasons, as we've heard from.
And in fairness, we have to be careful. There's no known positive patients in that county. I suspect very strongly there is SARS-CoV-2 in every county of Kansas.
Yep.
I think that's the logic. We have to remember that only a few percentage of patients present to the hospital who have it. So just because somebody's not been hospitalized does not mean that it's not in the county. That would be false
Absolutely.
thinking.
So it could be just unable to, not testing or just not going to the hospital for testing.
Yeah, people don't know.
But really, if you're having a procedure, and we've heard this from our surgical colleagues, and we know this, that if you're having a procedure, your risk of complications, either post-operative complications, even to the point of death, is increased if you are COVID positive. So that is really a patient safety issue more than anything, and your safety for sure.
Yeah, and I think that's really the key message. It's in the county. You may well be asymptomatic with it. Not a lot of people don't even really get very sick with COVID-19, especially younger, but even older patients we know don't really get all that, don't have to be sick with it. And then that's the thing. You think, well, I've got SARS-CoV-2, I'm going to die. No, wait a minute. No. That is not the case. Actually, it's still a relatively low percentage of people who come into the hospital, and then still a relatively low percentage of people who don't survive it. And I think that's one of the things we have to remember. But if you introduce a medical procedure on top of having SARS-CoV-2, that's a different story. So the reason you get tested is to protect yourself. So I understand you may think, gosh, I don't need to be tested. Wrong answer. The reality is you do need to be tested because you're going to have surgery and you don't want to have a bad outcome. That's really the answer. It's really to protect yourself. So, other questions?
Yeah, Dr. Stites, good morning. This is Nate.
Hi, Nate.
I'm sorry to bring up kids baseball again, but
yeah, we didn't. Did we strike out on our answer yesterday?
So.
Yeah, pretty good.
well, this one is because there are smaller communities that have few to no cases. Should those communities with I'm sorry, should sports in those communities start up again?
Oh, that's a
And
great question.
What
Well, let's just take a
precautions should they
poll.
take?
Yeah, let's take a poll. Let's see if we're all going to see the same thing. So I don't think we're going to bias this answer. I'm going to go right to Heather. Heather, what would you say if people wanted to play baseball back out around Hays again with small, well, yesterday's question was 5 to 7-year-olds, but let's say 10 or under.
We've got all kinds of questions. We got summer league basketball trying to gear up. We got people trying to dance. So we've got lots of groups trying to get back together. And I've been telling them just to follow the phases that the governor's put out, because I believe on phase 2, organized sports can start meeting, if I remember that correctly. So I've been trying to have everyone to wait till next week and then try to be really safe with it. Everyone wash their hands good and try to limit as much contact as much as they possibly can. So I don't know if that's the right answer, but
Well, I don't know if there's a right answer or a wrong answer. I think everybody may have a different one, but I like where you're going with that, because it says, let's give it 2 weeks to figure out before we go to the next phase and make sure cases don't escalate before we start thinking about things like that. Mark, what do you think?
I agree. I think that we have to, at some point, get back to life closer to what we once knew, but we have to be careful with that. And I think one of the most frustrating things about this process for me is just the lack of solid answers. There's a lot of gray. And so there is no right or wrong answer. And so I think you take a measured approach. You continue distancing as much as you can, and then you see how things go.
I think that makes a lot of sense. Christian, thoughts?
I would agree with Heather, is that we in Pawnee County are following the governor's guideline, and hopefully if the number of COVID cases remain flat, next week we will see some advancement in organized sports.
Yeah.
I think the other thing that, boy, I don't know that those kind of people are listening this morning, but I think it starts also with the coaches saying, if you don't feel good, if you're sick, or if there's family in your home that is sick, that resembles COVID. Let's not be sending these kids back out, back on the court, back on the field, back on the dance floor. And if people would really, take responsibility for their symptoms and kind of their family's symptoms, that would really help contain it well. We've been very lucky here at the beginning to have very responsible patients and quarantine themselves very quickly. And if coaches don't punish or, don't play the kid because they stayed home for a day or two sick, we've all been in those boats, that would really help. So hopefully the coaches can really support that idea as well as we get started back up.
Gray can be the loneliest color, right? And I think you're right about it's a lot of gray out there. It reminds me, sometimes when you drive outside, you can't see what's in front of you, and you just have to slow down and be really careful. Sometimes you pull off the road because it's so bad, and other times you can get back, you drive really slowly, really cautiously, and you look for what's in front of you. I think that's kind of the story that we're facing as we reopen society. We don't know how this is going to go, right? But if you go a little slower, you can be a little safer. And so if you even run into something, then hopefully you're not going to do much damage because you were going pretty slow. I think that's a story of COVID-19 right now, Dana. I think we have to be careful, go slow, because it is gray. We are pretty foggy, and our crystal balls aren't so great.
Mm-hmm. Yeah. We do know there are facts that we do know. Number one, this spreads like wildfire and is seemingly hyper-contagious. Number two, we know there aren't any no-case areas, so every place has cases.
You have it. Even if you don't think you do, you have it.
So when you plug the hyper-contagiousness or the efficiently contagious with new people who can be infected, as you open up, we have to assume and believe that there's going to be infection. So it does boil down to individual responsibility. As was mentioned before, if there's somebody sick in your household, please don't send your children out to be practicing with other people. When you are out, practice good hand hygiene, wear a mask, things of that nature. We also understand that when kids are together playing games, sitting on the bench, they're probably going to be sharing things such as water bottles and other equipment, and so that makes it even more dangerous. And so we definitely need to be cautious. We don't have a crystal ball. We don't know how it's going to be. We can only look back retrospectively at what has happened other places and kind of work from there. But we understand that as we do open up, there will probably be more cases.
Yeah, there are going to be more cases because it is out there. And the challenge for having youth sports is that kids will spread it amongst themselves, not be particularly sick, and bring it home to people who can be sick. So I think you just have to be careful. And what you really have to be wary of is of the those they syndrome. You see, those they syndrome affects us when we start thinking that it only happens to those people because they did something different, or they're in congregant living, or they have a certain area that they're working. And that works fine for you, that those they logic can work when you're sheltered at home. Once you go back out in public and suddenly you're going to look more like those people who had to be at work, or those people who are at the meatpacking plant, suddenly that those they logic comes to you. And then the world changes for you. And it can flip it can flip really fast. So when you do make considerations about your kids returning to youth sports, here's what the governor's office is saying. You have to take stock of your personal situation. Do you have an elderly parent living with you? Do you have somebody with chronic health conditions? Because if you do, it's really hard, but you're just going to have to be more cautious, because it really isn't a they disease. That's just the opportunity of the moment. The opportunity to have COVID will come to all of us if we're not careful as we reopen society. Next question.
All right, wisdom teeth. I have somebody whose daughter needs to have her wisdom teeth removed because they're starting to bother her. Her appointment was rescheduled for next week, and they want to know, what is your advice? Is it safe to have her wisdom teeth removed right now?
Dana, I have two comments. First, whoever in the world decided those should be called wisdom teeth, because they're not wise. I don't
Horrible.
get that.
No.
I mean, I don't know. We should ask a dentist on the show. We should have the dentist sometime on here and ask them that. Let's go find that. And I'm going to quiz them about why they call it wisdom teeth.
Right.
But what do you think about having them out?
You know, I think if you need procedures, then you need procedures. We understand that you can have probably bad complications of having wisdom teeth not pulled out, impaction and things of that nature. I know that the ADA, I believe, is the governing body in the United States. They have their guidance. We know that people working in the mouth or the oral area, such as ENT physicians and dentists and dental hygienists, are probably the highest risks to spread and or get the disease. So hopefully there are the proper precautions, protocols, systems in place to keep you as the patient protected and also keep the healthcare worker protected. And I would imagine that there probably is, but you could certainly sit down with your dentist and talk about those types of things.
Yeah, and I think that's right. I think as long as the dental office is doing all the right things about good precautions, the reality is this. COVID's here for a while. So unless you can wait a year until we get vaccinations and effective therapy, or however long it'll be, to have your wisdom teeth removed, you might as well go and get your wisdom teeth removed, because it's not going to get any safer. So you might as well, as long as it probably is safer right now, and as long as you're doing the right things, then I think you probably need to go get that done. Next question.
All right. I'm sorry, Jill.
Yeah,
I
okay,
know
I'll grab one real quick. Scientists are, in the news, they're saying scientists are worried about a coronavirus comeback. Are you, and is the health system prepared for a second wave?
Oh, man, I'll tell you what. That's funny. It's an interesting question. A comeback. Does it need to make a comeback, or is it just still out there? I'm not sure it need a comeback. Let's ask first out in Western Kansas. Christian, what are you thinking? As society opens up, are you worried about the next real wave coming out to your area?
Oh, definitely. As we expose more vulnerable populations to this virus, as we release restrictions throughout the state, I think we're definitely going to see a resurgence in numbers of COVID patients throughout the state.
And Heather?
No, for sure. We're going to see some more cases. And at the hospital here, we have not relaxed any of our visitor restrictions. We still have our medical care unit that isolates any patients that would have COVID in-house. So, and we don't plan on relaxing any of those measures staff or patients wearing PPE for the long haul. So this is business as usual. The benefit of right now is that, as you guys see as well in Kansas City, is that the testing is becoming easier. There's some quicker testing for the hospital. We're able to do rapid testing within a couple of hours for anybody in the hospital, which has really proven to have great benefit. So yes, I think there's going to be more cases, but I think we're also probably in a better place in regards to testing, and it sounds like maybe some new treatments coming along as well for those really sick as well. So I think it might be in a better place for the second
Good.
wave or the second comeback.
Yeah,
Volume two.
And Mark, your thoughts, same?
Yeah, I think, excuse me, I think very similar. I think we're going to see more case numbers, one, because it's going to spread more because we're out more, but also because we are testing more, so we're going to see more positives because of that. And I agree that we've had time to prepare and get ready so that if there is another wave that is significant, then I think we're ready.
Dana, I think the next wave is going to be pretty real, and I think potentially it's going to be greater. We're already seeing a few increased cases here in Wyandotte County, and there are some early signs, I think, that are suggesting, and maybe it's because we're testing more, that could well be, we may also be starting to see some more spread of the disease.
Yeah, absolutely. I mean, it's like, it's not like Milli Vanilli that went away and you don't need to come back. This really never left. So I think we have really managed it well here, and we've said that since day one. In our region, we've managed it so well because of the stay-at-home orders and everybody doing what they were supposed to be doing and being responsible. We have had ups and downs in our health system amount of patients, but also around the city. We are now at that equilibrium, but it won't take long and doesn't take a lot for a repeat surge to occur or a surge to occur. So absolutely.
And I would also offer that we're already seeing cell phone data that suggests that people are congregating more and over the last 7 to 10 days. And so I think that we're a little nervous about what all this will mean.
Yep.
But you can't keep society closed forever. And so I am definitely not a never ever type of person here. I think we're going to have to reopen. And again, that's a little out of our standard lane of healthcare. What I will say is that I think we're all better prepared. So as you reopen society, the supplies that we have are far better off today. The American supply chain has made a good comeback, and I think our infection control policies are in place. And so I think we've trained so many people around these things that throughout all of our system, I really believe we're a lot better off than if we had been overwhelmed or did a terrible surge before. Obviously, we don't want to see a surge, but it's possible. Of course, the way to handle that is to say, here's the government things, and here's my rules of personal responsibility. So even as you go back out into society, you can't eliminate risk, but you can really improve it if you do the things we talk about. Stay 6 feet or more. Here we are, 6 feet or more, 6 feet or more, all of us here in the studio. And make sure you wash your hands. Don't touch your face. And cough into your elbow. Don't go out if you're sick. And, wear a mask when you can. Especially, if you're going to be in an area where you cannot maintain social distance, you just got to have a mask on if you're going to be safe. I really think. It's different when you're in your car by yourself. But, man, when you're in that store, you're at the grocery store, wear a mask. You just be safe and keep your loved ones safe.
Yeah, and to your point, if you do go into the store and you are touching things, putting things in your cart, paying for things, wherever that store may be, and you are having a mask on, when you get into your car, if you don't have alcohol sanitizer, then go ahead and keep your mask on, because then you're just touching your face, contaminating your mask, things of that.
Yeah. The other thing is, like yesterday, we talked a lot about being in your bubble. And so you're responsible not only to yourself and the other people around, but really the folks in your bubble. And, I have a home bubble, I have a work bubble, and I got to keep all those people safe. And I think that's a personal responsibility that we all have to have. So. Any other reporters asking any thoughts or questions from any of you from this morning?
This is Nate. I have another couple questions. So I have one. It's a grandparent who wants our recommendations for visiting newborn grandchildren. And then I have another one that's a little bit more complicated, and they want to know.
That was complicated enough. Go ahead, Nate. Make it harder.
Well, the other one I think is one that maybe we can give a definite answer to, which is, what is the threshold that would instigate universal testing for all acute admits? Related, is the health system considering universal testing for employees providing direct patient care? And do these decisions roll out health system-wide, or are they individualized to each site?
Okay, well, let's take on that question first, and then we'll come back to the grandparents' question. Dana, what are we doing about testing all admissions?
Yeah, we are currently working on the process to test all admissions, all inpatients. We certainly are using it for any pre-op patients. As we talked about, it's a patient safety issue. But we are working on the logistics of doing testing, for acute testing for PCR, for all inpatient admissions at this point.
And to say
in
it's
time.
really an EMR question, we have to have the EMR fix in place
Right.
to do that, allow the ordering and the test to pop back up. I think there's only about 30 or 35 patients a day who we don't test, because we test everybody in the emergency room, we test all the pre-ops, we test the people who are sick. So the reality is there's only a few people. So we'll have that going pretty soon, I think. And I think, and we test all the patients before they get cancer and chemotherapy, et cetera, and down in the cancer center. But Heather and Mark and Christian, what's going on out in Western Kansas? Are you guys trying to test everybody now?
We've had a lot of discussion over that. I think really our inpatient quick rapid testing's got a little bit of a supply concern still. So we are testing kind of that same volume that you are. So there's, just a few people who fall in between that. We're doing a good job of screening patients right now. We don't have the community spread like you do. So I think until we can get a little more increase on our opportunity and supplies on the in-house testing, I think that's really going to be our hurdle for at least a short time frame.
Mark, Christian?
Like everyone else in Great Bend, we're also testing prior to surgery. We're testing more from a symptomatic standpoint, both in the community and among hospital employees, just because the case definition has been relaxed, so to speak. But we're not testing every inpatient unless they are symptomatic.
Christian, same or different? How do you?
I would agree with Mark. We are testing symptomatic patients right now. We try to transfer new inpatient transfers for swing bed, but we don't have the rapid turnaround time on the test, so it's causing us a few difficulties there for being able to test every patient coming in.
Yeah, and I think that's one of the keys. We're blessed; we have enough equipment to do that, and we're testing for some of our regional hospitals as well as health departments and first responders and some other hospitals here in Kansas City. So, I think the follow-up question is, do we test every staff member? And that's a great question, and I think it's kind of one that some people are moving to and some people aren't. The problem is that test is good for 48 hours, and you'd have to test everybody again. And I think that's a tricky question. So why are you really testing everybody? And is it really a good move? I think a lot of people are saying, well, we'll test everybody, but it takes us about 4 weeks. Well, I don't know what the negative test means 4 weeks ago, Dana.
Yep. Absolutely. And we know from a recent New England Journal of Medicine article about in nursing facilities, the patients anyways, they were testing positive 6 days before any symptoms. We know that the test that we do is for that point in time. You can maybe say it's good for 48 hours, possibly get it to 72 hours saying you're still good. But after that, you can start to either have been infected or start to develop symptoms. And so doing the PCR test is good for that point in time. So are you doing every week? That runs into then test kit shortages, media shortages, nasal swab shortages, so you can't test the people who really need it.
Yeah, so we have 15,000 employees in our system, and if we did everybody once a week, we're going to burn through 60,000 tests a month. Now, I got to ask if it's better to do that or if it's really just better to make sure everybody wears a mask and follows infection control precautions. We're going to return to that point in just a moment. But the flip side of it is that's 60,000 tests we can't get into the community.
Correct.
Where I think there's a lot more need than there is inside health system when everybody's wearing PPE anyway.
Yep.
So I'm not sure that on a social basis that's the right thing to do, just as my own personal thought, I guess. But,
yeah, and we understand our rate of employee positivity is the same or lower than the community spread anyway.
do.
So we are screening by questionnaires and with temperature.
And we know that we've not had any documented case of an employee giving COVID to a patient.
Correct.
Or SARS-CoV-2. But a lot of that has to do with our infection control stuff. And I think that's true across the country. When you read about it, that seems to be the real deal. It's about having really good PPE policies in place. So, okay, now let's get back to grandmother and newborn. Holy cow.
Gosh.
All right, Dana. That's up your alley, buddy. You're the ID doctor.
It's an easy one. So again, I think we are saying right now is probably the safest time to do anything, just because we've all been sheltering at home and nothing has been open. So probably the amount of cases or the prevalence in the community is probably lower now than it will be. Is it safe? Well, number one, have they been in your bubble or your social circle the past few weeks? I think there are ways that can make it safe, but it goes, again, down to individual responsibility and risk versus reward. So I think there are things you can do. Certainly if you can meet outside, that's a great thing. If you go inside, the risk is probably a little bit higher. If mom and dad and grandma can wear masks, I think that's important. Using hand hygiene right before picking up the baby and after getting done, things of that nature. If you can do all these little steps, and there's various ones like that, you can certainly lower your risk, because we know you want to see grandbaby, but you just have to take precautions. Make sure nobody in the house is ill. Make sure you're not ill. Go over to the house or wherever that may be. If you can meet outside, that's great. If not, then do it inside. But you have to do those other little things as well, and that will help reduce the risk as much as possible.
Yeah, I think that's the answer. It really comes down to what's the risk you're willing to take in your own family and your own life. And so there's no, the problem is, again, so well said earlier today, this is a gray zone. What's your level of risk tolerance? How good is your personal health? And are you willing to wait a year until a vaccine comes available, or whatever that time period may be? And if the answer is I'm not willing to wait a year, then I'd say, well, if you're healthy and you've got an inside bubble and people are maybe this is the time to go see that baby. So I think that's the challenges we all face. I had a patient of mine who called with this question the other day, and she and her husband both have some chronic illnesses, but their grandchild was born up in Seattle. What do they do? How long do they wait? They're going to have to fly to get there. They're going to have to quarantine once they get there. Do they see the baby? Now, the baby's not the person who's going to have the risk. It's the act of getting there and then seeing the baby who just come in from the hospital. So I think, they waited a few weeks. They tried to let things die down up in Seattle, where Seattle had done a good job of bending the curve. And I think they went. And you know what? That's that's just a personal question. I'm not sure there is a yes or no answer. So
We have a follow-up question for Dr. Harris. She said there's no community spread, but you've said there is COVID. So how are people getting COVID if there's no community spread?
Heather, do you want? I think that's probably just that's just a choice of words. But do you want to go ahead and take that on?
Right. So I mean, we haven't had a new case in a month, or close to a month. And then the cases that we had, at least a great portion of them were all. What's the word you guys are using in those groups? Those kind of a hot spot group.
Living. Yeah, clusters.
Yeah, cluster. That's the word I'm looking for. So one of them was a cluster, and luckily they self-isolated. And so we haven't had any more spread of it since those folks all got better and back to their regular worlds. I don't know if that clears that up.
Yeah, I think that's right. And we know that COVID-19 is and SARS-CoV-2, let's say that. The virus is out there. Yep. Whether people are presenting with the disease or maybe they have just very mild symptoms, they never came to healthcare. SARS-CoV-2, Dana, it's everywhere.
It's out there, yeah. And a couple of the patients that I had to call initially to say that they had it, I mean, one guy had some shortness of breath a little bit, but by the time I had called him with his diagnosis, he had already been out running 3 miles that day. Or there was another guy who got diagnosed, but 10 days before that, he had a cough for 24 hours. So these symptoms may be very short and may be very mild, but we know it's out there.
We have to remember that we say of the people who test positive, we're still running around 7 to 12% or whatever people actually test positive. So most are negative. Yep. But of those people who test positive, a very small percentage actually need to be in the hospital. Yep. And I think what's happened is everybody thinks, I test positive, I'll be in the hospital. No, that is incorrect. The reality is that a small percentage of people actually come into the hospital and a very small percentage of people don't survive. And so I think we've, in some ways in our minds, what we have to remember is that SARS-CoV-2 is a very bad virus, but most people are going to be fine.
Yep. And the problem is the overwhelming numbers of the people that get infected. So even those small percentages are large numbers. And again, we have to remember, when we see all these data points and these numbers of the deaths, I think it's 80,000 now or something like that. These are not just numbers, these are real people, these are our loved ones. And so that's why it is so vitally important for everybody to be doing these responsible things on an individual basis.
Yeah, and I think that's That's really our struggle. And if 5% of patients become hospitalized, and let's say that's a number, I don't know if it's somewhere between 2 and 10%. We'll assume it's 5% for a moment. And there's 2 million people that live around the Kansas City area, or 2.2 million. I use 2 million for simple math. That's 100,000 folks who are going to get hospitalized, and a small percentage of those people will pass away. So that's still a big number, though. That's still 2,500 people in Kansas City could die from that. So we have time for one more question, and before that, just a reminder that tomorrow we're going to talk about collateral damage from COVID-19. You still got to take care of yourself. We want to make sure that you're doing that, and so we're going to have a couple of guests tomorrow with us. One will be Mark Wiley, who's the chair of cardiology, who will be here and talking a little bit about people who may be having heart attacks at home. Dave Lisbon will return to our program from our emergency room. Dave does a great job of talking about how things are going down in the emergency room. We may have another special guest, too, one of our eye doctors. Dana, any last thoughts today?
Nothing other than we've said. Again, individual responsibility. Please don't go out if you're ill. We are starting to open up. We need to open up. People want to be around and out doing things. Cough into your elbow. Wash your hands frequently. Don't touch your face. Wear a mask when you're out in public. Do those types of things, and hopefully we can stay safe and keep the surge as low as possible.
Christian, thoughts from Pawnee Valley?
Well, I think we have been very fortunate. I know that the lockdown and stay-at-home orders has significantly changed people's lives, and that has an effect on their underlying disease. And so I want to encourage people that the hospital and the clinics in Pawnee County are safe. We've taken all the appropriate measures, and especially those patients with diabetes, hypertension, and most especially depression. If you're having problems, it is as safe as it can be to come in and get the treatment you need without having to fear a COVID outbreak.
Mark?
I agree 100%. I think in Great Bend, things are starting to return closer to normal. ER volumes are beginning to come back up a little bit. I also want to encourage people, get out and seek care. We can do telemedicine. We can do telephone visits if you don't have a smartphone or an iPad or whatever. And then I think as has been said, this virus spreads easily. There's a lot that are infected and don't know it. And so I think the onus comes down to protecting those that are most vulnerable. As long as we continue to do that, then I think we'll do well.
You bet. And well said there, guys. And Heather, how final thoughts from Hays?
No, I just echo what the physician said. We're safe. We're open. We want to see the patients. We want them to get treatment for their chronic conditions and any other acute symptoms that may have occurred during all of this, because we don't want people to get sicker than they need to because they avoided coming to see us, or have, not having surgeries or operations that are needed or necessary to continue, that they can be healthy beyond COVID. I mean, that's the idea, is for us to all get on the other side of this at some point, and we want to make sure that other problems haven't occurred because we're avoiding it because of our worry. So, and everyone just continue to be just healthy, sleeping good and exercising. And then again, as you guys all talked about, all the hygiene. And again, I tell people all the time, just if you don't feel good, stay home. And I hope people will continue that over the summer as well.
Yeah, I think you guys have done a great job this morning, and appreciate everybody being on with us today. And I just want to leave us with these thoughts about pronouns. Those, they, them. That's what the words we use when we're characterizing another group of folks. And I think we have to be careful. COVID-19 and SARS-CoV-2 doesn't care about those or they. It's a great equalizer. So I would just be cautious as you go back out into the world to think that it's not there, because it is there. And what you don't want to do is have those and they become I. The way you prevent I is to make sure you do all the right things around infection control. And that way, we all stay safe. Thank you very much. We'll be back with you tomorrow.